We are going to describe the anatomy of the head and neck through this series. The first will be starting by the skull, which is number 1. So about the skull, we are going to start by developmental background, how the skull develops. So developmental skull is divided into 2 parts, a neurocranium and viscerocranium. Let's start by the neurocranium, which forms a protective case around the brain. It protects the brain by forming the vault of the skull. And it is divided again into 2 portions. One of them is what we call it the membranous part, which consists of the flat bones surrounding the brain as a vault, as we said. And this develops intra or ossify intramembranously. The second portion or the second part of the neurocranium is the cartilaginous part, which forms the base of the skull mainly and ossify into intracartilaginous way. So the membranous neurocranium of the skull is divided or derived actually from the neural crest and the paraaxial mesoderm. The mesenchyme from these 2 sources, as we said, invests the brain and undergoes intramembranous ossification, while the cartilaginous neurocranium or chondrocranium consists of several separate cartilages which form the base of the skull, as we said. So the precaudal part of the chondrocranium, which lies in front of the rostral limit of the notochord, and that part ends at the level of the pituitary gland in the center of the sella turcica of the sphenoid bone. That is the portion which we call it precaudal chondrocranium, and this will develop on the bones up to that limit. It is derived mainly from the neural crest, while the caudal one, the caudal chondrocranium, are those bones developing posterior to that limit, posterior to the sella turcica, in the middle of the cranial cavity. It arises from occipital sclerotomes, which formed by the paraaxial mesoderm of the mesodermal somites. So the base of the skull is formed when these cartilages fuse together and ossify endocartilaginously. So that is the neurocranium, the membranous part and the cartilaginous part. The cartilaginous, as you can see, is divided into procaudal and caudal one. And the difference is in the way of ossification of both parts. The second part, which is the viscerocranium, and this forms the bones, which is the skeleton of the face, the bones forming the face. The mesoderm or the mesenchyme of this part is derived also from the neural crest, which forms mainly the mesoderm of the first 2 pharyngeal arches. The first pharyngeal arch will give rise to a dorsal portion, which will give the maxillary process, and that process extends forwards beneath the region behind or below the region of the eye, and will give rise to the maxilla, to the maxillary bone. and also to the zygomatic bone and part of the temporal bone. These are the derivatives of the dorsal portion. The ventral portion of the first arch is what we call it the mandibular process, which contain the Meckel's cartilage, and that cartilage ossified by intramembranous ossification, which will end by giving rise to the mandible. Meckel's cartilage will disappear completely and is represented only by what we call it the sphenomandibular ligament in adult. The dorsal tip of the mandibular process, together with the second pharyngeal arch, later will give rise to the two ossicles of the middle ear, the incus and the stapes. Now, let's look at the source of origin of the skull bones during development. Those in blue arise from or derived from the neural crest, as you can see here. The frontal bone, the nasal, the lacrimal, the zygomatic, the maxilla, the incisive teeth, and the mandible. These are the part, the sphenoid and the squamous part of the temporal bone, the hyoid bones. All those in blue arises from the neural crest or develops from the neural crest. Those in red are structures derived from the paraaxial mesoderm, the somites, the mesodermal somites or somatomeres. You can see the parietal, you can see the occipital, and part of the temporal bone. Those in yellow are those derived from the pharyngeal arches, which are the laryngeal cartilages, the malleus, the incus, and the stapes, which we have mentioned later. Now, let's have a look at the skull at birth. And mainly to see the main differences between the skull at birth and an adult skull. At birth, the flat bones which form the vault of the skull, which surround the brain, as we said, are separate from each other by narrow stem of connective tissue, which we call them the suture. They are fibrous joints. These are the sutures here, and those sutures derived from two sources. Neural crest cells, that is the sagittal suture, this one. The paraaxial mesoderm, which will form the coronal suture, that is the coronal suture here, from that end to that end. A point where more than two bones meet, sutures are wide, and these are called fontanelles. That is the anterior fontanelle, where those sutures are away from each other, and this is because of the way of ossification of the flat bones. Here you can see a bulging, the frontal tubercle, and another frontal tubercle here. That is the center of ossification starts here, and starts in a circular way. If you got a circle here of that parietal bone and another circle here around the tuberosity, the two ends of the circles will leave that wide part, which is the fontanelle. So that's how the fontanelle are formed. The most prominent of these is the anterior fontanelle. We are going to see the other fontanelles in the next slides. And this anterior fontanelle found between the two frontal bones and the two parietal bones. Now, the facial part of the skull, we are still discussing the main difference between the skull at birth and adult skull. So the facial part of the skull in at birth form 1/8 of the skull size, while in the adult it is 1/2 of the skull size. This due to the following: the small size of the maxilla, because all the paranasal sinuses, which are the maxillary sinus, the frontal sinus, the ethmoid sinuses, and the sphenoid sinus, all of them are rudimentary, they're very small in size. The mandible, which is not erupted of the teeth, is very small in size, as you can see here. So the small size of the mandible and the small size of the maxilla here, you can see the maxilla here is very small. The orbits are large, as you can see here. The germ of the developing teeth close to their floors, almost the developing teeth are very close to the floor of the orbit. The glabella, which is this part, the superciliary arches, which is here, we see it in the adult skull, and the mastoid process are not developed. So these all features, superciliary, the mastoid process, the glabella, this give to the small size of the face. The frontal and the parietal tuberosities are prominent, which I've seen in the previous figure, and that is the parietal and this is the frontal tubercles. As we said, this is the site of the center of ossification. Now, the base is relatively short and narrow. If you compare the size or the length of the base of the fetal skull and that of the adult, we'll find it short relatively and very narrow. The ossification of the bones is not complete. As we said, many bones consist of several bone elements united by the sutures and by cartilaginous tissue. The example, the maxilla, the occipital, the sphenoid, the frontal, and the mandible, united by fibrous or cartilaginous tissue. The mastoid process, as you can see here, had not started to develop. The paranasal sinuses are rudimentary, as I said, or even absent. Now, to continue, we are going to see the main differences of the skull at birth from the adult in relation to the temporal bone. In the temporal bone, the inner ear, the tympanic cavity, the auditory ossicles, and the mastoid antrum are almost of the adult size. These are the parts responsible for hearing, and this allows the child at birth to perform or to acquire the hearing process exactly as in adult. The tympanic plate is represented by an incomplete ring. That ring is shown here in yellow. That is the one, that is the tympanic ring, which does not develop to the adult side yet. The mastoid process has not started to develop, as we said. This is the mastoid part of the temporal bone, and you cannot see the mastoid process. The external acoustic meatus, this one here, is short and straight, and the bony part is not ossified and represented by that ring. That's why infection is more easy in childhood than in the adult, and even the danger of injury of the tympanic membrane is more easy in the childhood. There is absence of the mastoid burst, as we said, so the stylomastoid foramen, which transmit the facial nerve, is found on the lateral side, not at the base as in the adult skull. The Salot process has not fused with the bone, with the vitreous part of temporal bone, and then the mandibular fossa, that one, is flat and more lateral. That is the mandibular fossa. The articular tubercle has not developed, which is limiting that articular, that mandibular fossa. That is the vitreous part of temporal bone here, at childhood not well developed. And this is the squamous part of the temporal bone, separated from the mastoid part, as you can see here. Now, in the skull at birth, there is a number of fontanelles and number of sutures. For the fontanelles, this is the anterior fontanelle here. That is the posterior fontanelle down here. That is the anterolateral fontanelle here, the anterolateral one. And that is the posterolateral fontanelle over here. So there are 4 fontanelles: anterior, posterior, anterolateral, or what we call it sphenoidal fontanelle, posterolateral, or what we call it mastoid fontanelle. The sutures are the frontal, or what we call it the metopic, and this suture disappears by the age of 2 years after birth. It may maintain in certain species. The sagittal suture between the 2 parietal bones, the lambdoid suture between the occipital and the 2 parietal, the coronal suture between the frontals and the parietes. That is the sutures of the skull. Now to the adult skull. In the adult skull, we'll start by the general features of the skull, and those are the joints to start with, and all the joints of the skull are called sutures, and they are of the fibrous type. There is 2 ways to name those sutures. Either given name, like in the lower limb or upper limb, knee joint does not mean does not include the 2 articulating bones. Elbow does not again contain or mention the articulating bones. So named ones here are the metopic, which we said it only persists until the 2nd year of life, or in some species. The coronal suture, which lie between the frontal and the 2 parietals. The sagittal suture, which lie between the 2 parietal or interparietal suture. The lambdoid, which between the occipital and the 2 parietal. These are the 2 parietals, and this is the occipital. The lambdoid, that is the symbol lambda. That is the symbol lambda here. So we'll call it lambdoid. Pterion, and this is a very important one, which is the meeting between 4 bones: the temporal, the parietal, the frontal, and the sphenoid bone. This is the pterion. And asterion on the posterior here, between three bones, the parietal, the occipital, and the temporal bones. So you got pterion and asterion. These are the sutures which have names. The rest of the sutures of the skull will be named according to the two articulating bones, as in the rest of the body, radioulnar, tibiofibular, and so on. The example given here is the frontozygomatic suture between the frontal and the zygomatic bone. That is the first point, how to name the joints. Now the second general feature to be discussed is the bones. And the bones in the skull are very important to locate the structures inside the cranial cavity. And this is important for the surface marking of certain structure during surgery. So the bones, the nasion, and this is the root of the nose, at the root of the nose. So we call it the nasion, this part here. Second point is what we call it the glabella, between the two superciliary arches. That is the glabella here. The third is the bregma, the point at the meeting of the coronal and the sagittal suture. That is the bregma. The fourth point is the lambda, which is the point between the lambdoid and the sagittal suture here. That is the lambda. And the inion, that is the inion here. It is the center of the external occipital protuberance. These are the main points used in the skull. And as we have said or seen, the pterion is also there as a landmark for the anterior branch of the middle meningeal artery. And this is one of the most important points here, because this anterior branch of the middle meningeal, as we will know, is very commonly injured in accidents which happen to hit on the skull. And what is posterior is the asterion, as we described in the first part of the general features. The third point is the normas. The normas is how you study the skull by looking to different aspects of it. There is what we call the norma frontalis, looking to the front, the norma lateralis, looking from the lateral side, the norma verticalis from above, the norma occipitalis for the back. There is norma basalis externa, this looking from inferior to the skull, and inside the cavity we call it norma basalis interna. So we'll try to describe the skull according to these normas. The last point is the process, how we name the process of the skull. These are named according to the name of the bone that process is going to articulate with. There is many processes in the skull. We'll give one example. The example is a process from the temporal bone going to articulate with the zygomatic bone. So we will call it the zygomatic process of the temporal bone, this one here. The other one which will come from the zygomatic going to the temporal, now we'll call it the temporal process of the zygomatic bone. Here is again some points, the glabella which we have described when you are looking from the norma frontalis, the frontal bone, that is the maxillary bone, that is the zygomatic bone here, That is the mental protuberance here, this part here. Here is the supraorbital foramen or notch. Medial to it is the supratracheal foramen or notch. This is the lacrimal bone here, forming part of the medial wall of the orbit. And this is the nasal bone, the skeleton of the nose. And the root, as we said, is the nasion. That is the ramus of the mandible, and that is the body of the mandible. These are the main features which you're looking from the front. The mental foramen is this one here. If you are looking from the lateral side, that is the frontal bone, that is the parietal bone, that is the occipital bone, that is the temporal bone, that is the maxilla, the zygomatic bone, the sphenoid bone, and the mandible. These are the things you can see from the lateral side. The details of some of these bones will be taken in the separate bones. Now, that is again a sagittal section in the skull, so the different parts of the bones, the frontal, this is the frontal, this is the parietal, this is the occipital, this is the temporal bone in red, this is the sphenoid bone here in blue, that is the palatine bone here in white, the ethmoid in yellow, that is the inferior nasal conyca, a separate bone of the skull, and that is the maxillary bone here. This is again the mandible. If we look from the lateral side here, we can find the zygomatic process which said of the temporal bone, and the temporal process of the zygomatic bone. The occipital bone is here. That is the external occipital protuberance. That is the mastoid process. That is the frontal bone here, the parietal, the frontal process of the maxilla, the glabella again here, the superior temporal line, and the pterion, which is not a single point as we referred early. So where the frontal, parietal, squamous part of the temporal, and the greater ring of the sphenoid bone will meet each other, and we mentioned the importance of that point. If we go to the Norma externa, the main features which we have to look for, the incisive fossa, the median palatine suture or intermaxillary suture, the horizontal plate of the palatine bone, the posterior nasal spine, that is the posterior nasal aperture or conica. Here is the sphenoid, the scaphoid fossa. That scaphoid fossa is actually the division of the posterior border of the medial pterygoid plate, and it is better to call it tubal fossa, as the auditory tube, the cartilaginous part of the tube, lies in that scaphoid fossa. So better to remember a tubal fossa. That is the apex of the petrous part of temporal bone here. That is the carotid canal. That is the articular tubercle, which is anterior to the mandibular fossa. That is the foramen lacerum here. To complete the Norma bizalis, this is the pterygoid hamulus, and that is the lateral pterygoid plate, and this is the medial pterygoid plate, which we said it will divide to form the scaphoid fossa. Here is the spine of the sphenoid, which is close to it is the foramen spinosum here. That is the external occipital crust here. That is the external occipital crust. That is the foramen ovale here. That is the foramen ovale. And next to it is the foramen spinosum. This one here. This is the mandibular fossa, which you have seen before. And this is the jugular foramen. This is the mastoid process. To continue on the Norma bizalis externa, this is the zygomatic arch, the squamous fissure in the floor of the mandibular fossa, and this will give passage to the chorda tympani. We'll come to know that branch of the facial nerve. That is the mastoid foramen over here, foramen measuring vein. That is the external occipital protuberance. Center of it is the inion. That is the mastoid notch, the occipital condyle, articulating with the first cervical, the atlas. That is the stylomastoid foramen. And this is the foramen magnum. Now, the Norma bizalis interna. The main features we have to look for is the frontal sinus, the frontal crest here, the foramen cecum, the cresta galli, the cribriform plate of osmoid, bone. That is the groove for the optic chiasma, what we call it prechiasmatic groove. That is the lesser wing of the sphenoid, which is apertured by the optic canal. That is the greater wing of the sphenoid, which have the foramen rotundum, spinosum, ovale, and the spinosum. That is the carotid groove on the medial side of the body of the sphenoid, holding the internal carotid artery. And this is the orbital plate of the frontal bone. To continue on the Norma bizalis interna, that is the tuberculum celli, which is the anterior part of the pituitary fossa or the sella turcica. That is the dorsum celli, which limit the fossa from backward, from behind. That is the anterior clinoid process, and this is the posterior clinoid process on each side of the dorsum celli. Here is the groove for the superior petrosal sinus, and this is the groove for the inferior petrosal sinus. This is the petrous part of temporal bone. One on its upper border, the superior, one along its lower border, the inferior petrosal sinus. That is an area called tegment tympani. We'll see it in the temporal bone. And this is the roof of the middle ear. That is the clavus or ascending rod, which is formed by the body of the sphenoid and the basilar part of the occipital bone. They unite over here, forming the clavus or the ascending part of the skull. Again, to continue, that is the groove for the middle meningeal artery. or medial meningeal vessels. That is the cerebellar fossa in the occipital bone, where the cerebellum will be lying. Here is groove for the sigmoid sinus, which will end up at the internal jugular vein. That is the petrous part of temporal bone. That is the arcuate eminence, elevation by the cochlea. That is the groove for transverse sinus here. That is the internal occipital protuberance. Continue on the cranial cavity, or what we call it the Norma bisalis interna. We can see the foramen cecum here, anterior to the cresta galli. This is the cresta galli here. The optic canal, which is an opening into the lesser wing of the sphenoid. The foramen rotundum and the foramen ovale and the foramen spinosum. Three of them are found in the greater wing of the sphenoid. Here is the foramen lacerum, and the word lacerum means one eye or one end. It's opened only in the cranial cavity with an opening where the intercarotid artery mainly will be there. At the base of the skull, it's closed by fibrocartilage. That is the internal acoustic meatus. And this is the jugular foramen, which will give passage to the sigmoid sinus to become the internal jugular vein. And that is the foramen magnum over here.